You for joining us yet again for a weekly update. Earlier this morning, we opened our vaccination eligibility to Hoosiers 16 and above. I'm just so thrilled that we're at this point on the eve of April. A lot of progress has been made in recent weeks, so now that everyone who is eligible and wants to be vaccinated 16 and above can schedule that appointment. We still have some appointments obviously to fill, so they're out there, and we'll be adding to that. Dr. Box and Dr. Weaver will update this in just a few moments. We'll be as vaccination, our supply increases, so will your ability to schedule an appointment. And we've, our estimates earlier this morning, we looked at this, and about 39% of eligible Hoosiers have been vaccinated or made an appointment, I guess I should say, to be vaccinated. So first dose, full dose, or made an appointment to be vaccinated, 39%. So we're about at 40%, got a long way to go. Fortunately, the supply is there. And more good news is, along with and only because of our federal partners, we've announced that we're going to have an 8-week mass vaccination site in Gary, Indiana, which not only enables us to get out, 2,000 doses per day for an 8-week, 7 days a week period, real sustained effort. But that's also going to, as you described, alleviate and we will be able to send mobile units out throughout northern Indiana.
With another 1,000 doses.
With another 1,000. So with the 500 sites that we already have around the state of Indiana. So it's a big deal to have that mass vaccination site in Lake County and Gary, Indiana, like we've had in Marion County as well, and others. But to have that for that 8-week period, it's a big deal. And then to be able to send the mobile units out. But again, the docs will have more on that. We also have, I'll be quick about this, we also have Fred Payne with us. I mentioned last week we'd get an update on our unemployment claims and all he's doing to prevent cyber attacks and fraud and how all these things work together. So with that, I'll turn it over to Dr. Box for our weekly update.
Thank you, Governor. Good afternoon, Hoosiers. Today is the day we've all been waiting for, the day that any Hoosier age 16 and older can schedule a COVID-19 vaccination appointment. This means that any Hoosier who falls within the age groups for which the vaccine has been authorized now has the opportunity to be vaccinated against this disease. As of this morning, approximately 5.4 million Hoosiers can now sign up for a vaccine. Millions of Hoosiers have already done so. Just today, we saw 21,000 appointments scheduled in the first 30 minutes of expanded eligibility, and 96,000 people had made appointments as of noon. This milestone also means that age is now the only eligibility requirement to receive a vaccine in Indiana. We also have removed the language requiring proof of residency. We have made this change for several reasons: to comply with requirements at the FEMA site. We also know that some individuals may live in a household with multiple individuals but lack a document that shows an Indiana address. And students at colleges and universities, or even some people in Indiana workplaces, may live out of state but spend a significant amount of time in Indiana. We want to remove any barrier. If you are age 16 or 17, you can only receive the Pfizer vaccine, and we ask that you bring a parent or guardian to your appointment if at all possible. If you cannot, most locations will accept a written consent or a verbal consent by phone. Individuals age 18 and older can sign up at any site by visiting rshot.in.gov, by calling 211, or by going to one of the federal pharmacy partner sites like Kroger and Meijer. Individuals signing up through rshot.in.gov will find more than 530 locations that are offering vaccine. Those appointments are spread out over many weeks to ensure that enough vaccine is available to accommodate the appointments. You will find special sites like the mass vaccination clinics at the Indianapolis Motor Speedway, which opens tomorrow, and the 8-week clinic that will be held in partnership with FEMA at Gary Roosevelt's Park beginning next Wednesday. You will also find appointments or extra clinics being added at existing vaccination sites, such as our local health departments, community clinics, and hospitals. Partnerships have been a hallmark of the pandemic response, and the vaccine rollout is no exception. An incredible amount of work has been done by partners at the local, state, and federal levels to get to this point, and it doesn't come a day too soon. We have said before that we are in a race between the vaccine and the variants. Unfortunately, right now, the variants are picking up steam. Indiana has now reported 137 cases of the UK B.1.1.7 variant, 2 cases of the B.1351 variant out of South Africa, 1 case of the P1 variant out of Brazil, and 27 cases of the California variant. Our proximity to Michigan, which is one of the top states for B.1.1.7 variants, is also a concern. I say this to remind Hoosiers that COVID is still very much present in our state and encourage everyone who is eligible to sign up for a vaccine as soon as possible and to continue to wear a mask and take precautions. If you're looking to visit the iconic Indianapolis Motor Speedway for your vaccination, know that the clinic is filling quickly, but that appointments remain for the week of April 18th and the final week of April 24th through the 30th. And I think actually only the 24th through the 30th is open at this point. If you live in northwestern Indiana and want to come to the mass vaccination clinic, that will be open next Wednesday in Gary, and we'll be opening those appointments by the end of the week. You will be able to sign up at ourshot.in.gov at that time. The Gary Clinic can provide 2,000 vaccinations a day. It will offer the first dose of Pfizer for the first 3 weeks and the second dose of Pfizer for the second 3 weeks, and then Johnson & Johnson for the final 2 weeks. It will be held in a drive-through format, but will also have opportunities for individuals who travel by bus or other modes of transportation so that there is a walk-up option. In addition, as a supplement to the Gary site, we will have 2 mobile units that will host clinics in 9 counties across northern Indiana in the coming weeks to help ensure that the vulnerable communities have easy access to the vaccine. These clinics will be able to administer 1,000 doses a day and will allow us to further reach underserved populations. This week, we also launched a Spanish line through 211 so that our Spanish-speaking Hoosiers have easier access to information and help with registration. Callers to the 211 select the appropriate prompt that will direct them to a team of Spanish speakers. On the first day, the team answered nearly 400 calls and scheduled more than 180 appointments. And our Zotec registration system is now available in Spanish, and we're adding Burmese soon. As we increase our vaccination and outreach efforts, we are also working with our partners at the Regenstrief Institute to better identify breakthrough cases. Breakthrough cases occur when an individual tests positive for COVID-19 at least 14 days or more after receiving their full vaccination. That means the person has received either 2 doses of Moderna or Pfizer or a single dose of the Johnson & Johnson vaccine. We identify these cases by matching data on our vaccination to our vaccination data. So anybody who tests positive, we match it with the vaccination data. We have identified 221 breakthrough cases as of March 16th. These cases represent less than 0.04% of individuals who were fully immunized as of March 16th. More than 21% occurred in individuals age 80 and older. We will continue to work with Regenstrief to track breakthrough cases to review the symptoms, the diagnosis, and the hospital stays. We will also begin testing samples from these cases to determine if they were caused by variants. This will help us to better understand the vaccine's effectiveness against variants and inform our strategies going forward. As we've done throughout the pandemic, we remain laser focused on the data we receive. Nearly 2.8 million doses have been administered. That includes more than 1.7 million first doses of Pfizer or Moderna and nearly 61,000 doses of the Johnson & Johnson vaccine. More than 1.1 million Hoosiers are now fully vaccinated, up from just over 1 million last week. This means that more than 21% of Hoosiers for whom the vaccine is authorized have received either 2 doses of Pfizer or Moderna vaccine or a single dose of the Johnson & Johnson vaccine. When we look at vaccine uptake by age, we find that nearly 74% of Hoosiers age 80 plus have scheduled or received a vaccine. 77% of those 70 to 79 have done so. 66% of those 60 to 69 are getting vaccinated, and 48% of those ages 50 to 59 are in line or have gotten their first dose. 35% of those ages 40 to 49 have signed up. We also have seen 25% of people age 30 and older sign up. Almost 10% of Hoosiers aged 20 to 29 have already signed up. We know that more than 24,000 Hoosiers ages 16 to 19 have also scheduled a vaccination. These numbers also include more than 152,000 first and second doses administered to residents and staff in long-term care. Those numbers are encouraging, but we must remain cautious as our positivity rate has ticked up slightly. It now stands at 3.9%, up from 3.3% last week. We also have seen a slight increase in the number of Hoosiers hospitalized. The number of Hoosiers currently hospitalized with symptoms of COVID has crept back up to 657 as of yesterday. While this is still far better than the nearly 3,500 hospitalizations we saw just a few months ago, it is something we will continue to monitor closely. Daily hospital admissions for COVID remain at some of our lowest levels in months, but they too have increased slightly to just over 60 per day. Our color-coded county maps still look much better than they did a few weeks ago, but they've shifted slightly. The number of counties in blue on our 2-metric map has dropped to 53, down from 66 last week. 2 counties are in orange and the remainder are in yellow. Our advisory map has also shifted this week. This week, we have 2 counties in orange, up from just 1 last week. 48 counties are in blue, which is down from 57 last week. The remainder are in yellow. These metrics tell us that cases are increasing in parts of the state, which again serves as a reminder that we cannot throw caution to the wind and behave as if the pandemic is over. We want the pendulum to swing back in a positive direction so that we can prevent hospitalizations and save lives. Today, we reported 1 new death, which brings our total lives lost to 13,039 when you include both confirmed and clinically diagnosed deaths. The best way to prevent further loss of life in this pandemic are to follow the mitigation measures we've discussed for over this past year and to get vaccinated as soon as you are able to do so. This layered approach is truly our best path forward. And now Dr. Weaver has some more updates on our vaccination efforts.
Thank you, Dr. Box. We are embarking upon one of the most exciting times in our pandemic response over the next week, and we hope to see Hoosiers turn out in droves to get their vaccine. We were notified yesterday that we can expect more than 405,000 first and second doses of vaccine this week. That includes 88,920 first doses of Pfizer, 66,900 first doses of Moderna, which is an increase of about 2,000 from last week, and 96,500 doses of Johnson & Johnson. These supplies are critical to our efforts to get shots in the arms of every Hoosier who wants vaccination as quickly as possible. In addition to the mass vaccination clinic starting tomorrow at IMS and next Wednesday in Gary, we are working to get vaccine to large businesses and institutes of higher education in very short order. Our business and industry efforts are focused initially on those businesses that have 1,000 employees or more. Approximately a dozen businesses are in the process of launching vaccine clinics at this time. The majority of these companies have in-house or third-party health partners who administer the vaccinations to their employees, and the sites will receive primarily Pfizer vaccine. This week, we were able to allocate 24,000 doses to distribute to those businesses. Multiple other organizations are in the process of finalizing their plans, and we expect to allocate another 6,000 doses for those entities this week. Last week, we also sent a survey to colleges and universities to gauge their willingness to receive vaccine to administer to their students and staff. Our goal is to provide at least the first dose of vaccine to the students before they leave campuses for the semester. We will be allocating 60,000 doses of Pfizer for this purpose. 6 campuses are planning to begin vaccinations next week, and those are IU Bloomington, Purdue, IUPUI, Notre Dame, Butler, and Goshen College. 3 other campuses are in the process of finalizing their plans, and we have heard from at least 6 others that are partnering with their local health systems in order to vaccinate their students and staff. While we might not be able to provide both doses to students before they leave campus, every student who receives a vaccination will get their card so that they can then use it to schedule the vaccine in their home community or state. This will help protect not just Hoosiers, but individuals in other states from COVID-19. Pharmacies participating in the federal program are receiving more doses of vaccine. Currently, 125 Walmart locations are participating in the program. You can register for appointments at those sites through ourshot.in.gov. In addition, 113 Kroger locations, 39 Myers, and 23 independent pharmacies are participating in the federal program. This brings the total to 326 number of pharmacies providing COVID-19 vaccinations to Hoosiers around the state. As more vaccine arrives, our team will be working on plans to get it to more locations so that it can be conveniently located to Hoosiers in all corners of the state. Currently, 88% of the population is within 5-mile radius of a vaccine clinic. Additionally, the Homebound Hoosier program has vaccinated 754 individuals, and we are getting vaccines to more every day. Finally, I wanted to reiterate what Dr. Box said. We are very excited to extend eligibility to young Hoosiers today whose lives have been upended, just as ours have. Missed proms, virtual school, sports and events without all of your family and friends in the stands is not the high school or college experience you imagined. Well, now, 16 and up, it is your shot. Because 16 and 17-year-olds can only receive the Pfizer vaccine, we have updated our map at ourshot.in.gov to provide color coding that shows which type of vaccine is available. If you are looking for Pfizer, search for sites marked in yellow. You can also easily see sites that have Johnson & Johnson or Moderna, as well as those that offer multiple types of vaccine. We have also heard great news coming from Pfizer that their clinical trials of 12 to 15-year-olds have found the vaccine to be 100% effective in preventing COVID-19 and was very well tolerated in those populations. Pfizer reported that it expects to seek emergency use authorization from the FDA for these populations soon. So our hope is that we will have yet another age group that will be eligible to be vaccinated by this summer. In the meantime, the most important thing that we can all do to protect our children who cannot yet get vaccinated is to get vaccinated ourselves. We are extremely appreciative of those partners who have been working all hours for the past 3 months to get vaccines in arms as quickly, efficiently, and safely. There are a lot of amazing things that these partners are doing across the state to get the vaccines in arms. Hospitals, local health departments, and FQHCs, in addition to the normal vaccine clinics, are doing specific outreach and dedicated clinics for at-risk, vulnerable, and vaccine-hesitant communities. And to all of our other partners, community leaders, Zotec, Lilly, local health officers and their teams, those working at all the vaccine sites, all of the volunteers, the hospitals, and the Vaccine Advisory Committee. The list is too long to name you all, but thank you. And to all of you for everything that you've done, reaching out with words of encouragement, and for all of you who are doing things that you can to protect yourself and others. Thank you.
Thank you, Lindsay. And Fred, you want to give us an update on all the progress you've made to date? It's been a long haul, but to date in terms of claims and fraud prevention and those cyber attacks that I alluded to earlier?
Yes, Governor. So it was about this time last year that we saw the highest number of initial unemployment claims filed in recent Indiana history, at 139,000 in 1 week. At the beginning of this month, for the week ending March 6th, we saw about 9,200 initial claims filed, which marks the lowest since the pandemic started. Now that number has fluctuated since then, and we anticipate it to trend down. This is confirmation that we are headed in the right direction. Now there have been a lot of changes and challenges since this time last year, including the creation of several federal programs that have helped Hoosiers financially. Now, while we've ensured that the vast majority, 85% of claims are processed within and paid within 21 days, nuances and significant reasons for the remaining 15% to have continued investigations exist. Now, before I go any further, I want to correct something that I hear often. Claims are not people. Claims are what people file each week to request unemployment insurance benefits. People are claimants in this system. I've often heard people use claims interchangeably with people. This can be confusing, especially when referring to the numbers of claims processed. For example, a person a claimant could have filed more than 25 claims to cover 25 weeks of unemployment benefits. Now, to put this in context, we received approximately 18.4 million weekly claims filed by claimants between March 2020 through February 2021. Of those claims, 86% have been processed as paid or denied. Now, through the middle part of last month, 15.8 million weekly vouchers claims have been resolved since March 2020. 2.5 million are unresolved, of which 2.3 million are being investigated as suspicious, which is 89% of all outstanding claims. Now, throughout the pandemic, more than 850,000 Hoosiers have been paid unemployment insurance benefits. By comparison, in 2019, over 82,000 Hoosiers were paid unemployment insurance benefits. Now, I'll share a few real-life examples of the more challenging claims processing that go beyond 21 days. Now, to protect the privacy of claimants, no names will be used and other potential identifying information has been changed. One big issue that causes continued processing, that's called a job attachment issue. A job attachment issue occurs when the information we have does not clearly indicate that a claimant has been properly employed to make him or her eligible for benefits. Here's an example of a job attachment claim that went beyond 3 months. In December, a claimant filed a PUA claim and requested benefits retroactively back to May. The date indicated his business was impacted due to COVID in May. Because the person made a request for payment of benefits several months after he was reportedly impacted, this immediately created about 24 dated claims for the person that needed to be investigated. Here's what the continued investigation uncovered. The claimant stated that their business that was closed was a hairstylist at home. The claimant stated that the home address was in another state. There were 2 phone numbers associated with the account from another state. There are 2 phone numbers. Those 2 phone numbers were inactive. There was no history of Indiana wages reported, and claimant had no Indiana driver's license or history of tax returns. Our claims investigators investigated and called the phone numbers that were inactive, and we sent emails and deadlines to provide information. Now, another example, we received calls and inquiries from and about a claimant with similar characteristics, but a different job, that she had filed for benefits in March and had not received any benefits from our agency. The investigation revealed that the person had, in fact, filed for benefits, but did so in December and requested retroactive benefits back to March. A further investigation revealed similar characteristics as the claimant before. Now, these are examples of matters that take an extreme amount of time for investigators to process, even if the process leads to a non-payment, overpayment, or payment if eligibility is deemed. Now, I'll give you one additional example of where a claimant was actually frustrated with the time that it took to use one of our required tools that we put in place to stop fraud. The person filed a claim in 2020 and was being paid weekly benefits. Because of the new verification requirements from the U.S. Department of Labor on PUA claims, the person was asked to update and verify identity information through ID.me, the vendor we're using to help verify a claimant's identity. The claimant ran into issues because she had multiple attempts with the online self-service process. Now, this could have been because there were too many login attempts that threw up red flags in our system, which then required the person to go through another process to have an actual person to assist. Unfortunately, during the time this claimant was moving through the process, there were long wait times with our vendor ID.me, and the person did not get through the process quickly. She was delayed. The person's issue was resolved and benefits resumed. However, this is an example of our system not working as we desire it to work or working as quickly as we want it to in certain situations. Now, we continue to work with our vendor on this issue. Now, these are just small examples of claims working their way through processing that may take longer than 21 days. These are also examples of how resources may be tied up on chasing claims that may be fraudulent, which impacts the processing time for legitimate claimants filing for benefits they are truly owed. Now, I want to take a few moments to talk a little bit about fraud. Now, fraud has become a dominant factor in our unemployment insurance system, and it does impact processing time. As an example of the magnitude and the sophistication coming from the fraudsters, consider the following. From March 16th through March 30th of this year, Uplink, our unemployment insurance system, blocked more than 63,000 bot attempts to defraud our system. The heaviest period of bot attacks that we've had was in November, when we blocked 17.9 million attempts in a 10-day period. We're aware that some of the fraud detection and prevention measures we put in place may be inconvenient for some and impact processing time, but we must have them in place to combat these criminals and to ensure that only those who are eligible receive benefits. Now, while we're ensuring that benefits are being administered, we're also working to assist Hoosiers to reach their employment potential in matching them with available jobs and providing education and training resources to assist people to achieve their career goals. Recently, we launched the Hoosier Talent Network, which uses artificial intelligence to help match people to jobs and to match them with potential training they could receive to boost their employment opportunities. Now, while a lot of work remains, there are many positive indicators that show that we're closer to economic and employment recovery. This includes Indiana's current 4% unemployment rate, which is down significantly from the record high of 16.9% back in April of 2020. We've come a long way over the past 12 months, and we have a long way to go. But with consistent and measured strategies, we'll continue to move forward. Our agency is committed to providing benefits to all eligible Hoosiers while increasing opportunity to evolve people's education and training levels, which will lead to greater career choices. Finally, for those who are interested in unemployment data, we've added a new public-facing benefits dashboard to our agency homepage. You can visit it at dwd.in.gov. Thank you.
Thank you, Commissioner Payne. Very thorough. Stick around. Don't go anywhere. You've thrown a lot of numbers out there, so I suspect there'll be some follow-up. I should also say, in terms of follow-up, I alluded to last week, this may very well be the last regularly scheduled health press conference on a Wednesday at 2:30. It looks to be that to be the case. Going forward, next week I know you and I'll be up Tuesday, you'll be up Tuesday, Wednesday up in Northwest Indiana. So in addition to being out and about, we're still going to be available. We'll still be putting out from the Department of Health and keeping our, not just records updated, but any decisions on a daily basis, they're going to be updated. And, we'll reserve the right to call a press conference if time doesn't dictate, if the sensitivity of the decision to call a 2:30 Wednesday press conference, I'll look to that to be the case, but we'll plan on, not just because of the next 3 to 4 weeks of the legislative session when things are starting to really pick up steam and things are moving very quickly upstairs, thankfully. But we'll be available to answer any question every single day. I tell Rachel, get some sleep, but I think she's available 24/7. With that, Rachel, sorry to put you on the spot, but let's open it up.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay. Congratulations, Lindsay.
Is this your last presser? Because it's also my last presser. That's not my question, but
It seems appropriate. It's all about you.
was curious if you or Dr. Weaver could share any more information about the businesses that are having their own vaccination clinics. I know you said you think there's about a dozen now. Could you name any of the businesses, and how many do you expect that to increase to? How quickly will it increase? Any other information you could share would be great.
And Lindsay, no dropping the mic after you answer this question. I know you. You want to talk about the program that we've all worked so hard on?
Yeah, so we've actually been working on a plan for this for several months now and have engaged businesses, first a small group of 10 businesses just to get their feedback on what this would look like, and then provided a playbook of sorts for businesses and industries. And we sent that out to, I think it's almost 300 industries in Indiana that have 1,000 or more employees to allow them to start the process of figuring out what would this look like to them. We believe, and talking to the businesses, they believe too, based on their prior experience with flu clinics, et cetera, that bringing the vaccine to the employees so that they can get it there, make it really convenient, will increase our vaccine uptake. So a lot of them have been engaged for some time and are ready to go, and we expect more to come on as they, finish the process and the steps that they need to be sure that they can receive the vaccine.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon. How are you doing today?
Very good, thank you. Beautiful day.
Here, hopefully for the doctors, Holcomb, you may chime in here as well. One of the questions I start to see more and more often from our readers is why should younger people who are at relatively low risk from COVID-19 get vaccinated? So I was hoping that you guys could restate the case for why that's necessary and encouraged. And then the other question for Governor Holcomb.
Yep.
As we're seeing some slight upticks in cases, positivity, hospitalizations, and we're heading into next week where we're pulling back on the mask mandate and the county restrictions. I'm wondering whether you feel this is a toothpaste and tube type situation, that if things start to spiral upward again, are we going to be in a situation where maybe reimposing those things becomes unpalatable?
Two really good questions. You want to, or Dr. Weaver, want to take a crack at the first youth, and then I'll take the second?
So a really good question. I think that it's multifaceted. I think number one, if you look at Michigan right now and their increased cases and hospitalizations, a large percentage of those individuals are in that 30 to 39 year age group. So we are seeing younger people hospitalized with this. But I think most importantly, I think a lot of our young people kind of want their life back, right? They want to be able to go to concerts, to get together in the bars and feel comfortable that they're not going to get ill from this disease. We know that the more infections that we have, the higher risk we have of more mutations occurring and potentially getting a mutation that is actually worse than the mutations or concerning mutations that we have now. But I do also want you to know that our breakthrough cases we typically see oftentimes in our more elderly population whose immune system doesn't work as well. So by the fact that younger people will get vaccinated, they will continue to improve the atmosphere and the environment around their loved ones, their grandma and their grandpa and their parents and other people who might tend to be at higher risk for having a breakthrough case. So I think a lot of reasons to do it, but most importantly for them to be able to get back to the life that they have really been missing and they want to enjoy.
Lindsay, ditto?
Yeah, I would say ditto. Low risk doesn't mean no risk, and I echo Dr. Box's points about the variants. We are seeing an increased risk of hospitalization with some of those, and we're keeping a really close eye on that. And as she mentioned, there's some people, one, who can't get vaccinated or got vaccinated and maybe they are on chemotherapy, and so they didn't get the antibody response they wanted to, or are elderly. So again, it's, about protecting others. And I know a lot of young people are motivated over the fact that when you're vaccinated and you're protected, mean you can't spread it to others anymore or get it. That also means you don't have to quarantine, which I know has been very disruptive to all of our lives.
Yeah, and in terms of the second question, Steve, I would say that we have been very clear since the outset of our desire to try to drive down deaths and hospitalization rates. They have come a long way, moving in the right direction. We unfortunately reported one today, death. Reported one. But having said that, it's not just one number that I focus on, the positivity rate. It's many numbers in terms of our ability, first and foremost, to care for those who are hospitalized, whose lives are threatened. We do want to do all we can because to reduce the spread as well. We do want to make sure that we keep up our surveillance, our testing, and our tracing efforts. The vaccination rollout with 500 sites, adding more supply inventory, is having a positive impact. But by no means, this is what I said a couple of weeks ago, this is not mission accomplished. Yes, there's some personal responsibility that will be demanded if we want to continue to manage our way through this. But manage our way through this, we are doing. And it's, again, not just one number, but it's many that factor into the equation as I see it.
Kayla Sullivan, Fox 59.
Kayla, how are you?
Doing all right. I hope you guys are well as well. This question is for Commissioner Payne. We continue to hear from people who are waiting months for claims or appeals and struggling to make ends meet. You know, they describe being unable to get any information from DWD representatives when they call. So what are you doing to deal with the backlog, and what is your message to those families not able to even get in touch with those representatives, they say?
Thanks for the question. That's a good question. We're continuing to make sure that we reach back out to individuals who call us or they send us emails, and we are continuing to work through those. As I mentioned earlier in my dialogue previously, there are reasons for some of the continued claims, which does impact the time that it takes for an individual to be returned, for a phone call to be returned, and for emails to be returned. But we are working through that, so the message will be that we'll continue to make sure that we'll pay all eligible Hoosiers, and we'll make sure that we get to them as quickly as possible.
Trevor Peters, Fox 19.
Afternoon, Trevor.
Hi, Governor. Earlier this week, Kentucky Governor Andy Beshear said if given the opportunity, he would ask you to rethink getting the mask mandate. First of all, has he done this? Second, curious your thoughts on those comments. And then a little bit of clarification on the proof of residency change. Are you now saying that people, say in Cincinnati, who can't find an appointment can now cross into Indiana and get a vaccine because even though they may not be a resident?
You want to take the residency, and then I'll take the because it's not just Cincinnati. I get your point, but it's Kentucky, Illinois, Michigan, and Ohio.
So definitely it's our preference that individuals who live in Indiana, work in Indiana, are the ones that come over and get vaccinated here, because we do get allocated vaccine based on our population. But what we want to do is remove any barriers. And we knew that we were going to be vaccinating college students, that many of them live out of state or sometimes even out of the country. And we knew with opening the FEMA vaccine site that was another requirement, that there was really no residency requirement. So in that spirit, with opening it to everyone, that's why we removed the residency requirement.
Lindsay, anything? Trevor, I would say that Governor Beshear has my cell phone number, and he clearly has the media's number as well. He has not contacted me. I did see his comments, and I would just say that I've always taken the approach. My style has been to respect all other governors and the decisions that they have to make according to the numbers and what's happening on the ground in their states. And yes, there are some. We've vaccinated about 18,000 Kentuckians here in the state of Indiana, and so there is some. I understand the folks that live in Kentucky, or the folks that and work in Indiana, or the folks that live in Indiana and work in Kentucky. Completely respect that, but I'm paying attention to the numbers in Indiana and what's in the best interest for Hoosiers.
Nikki Kelly with the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon. I have two questions. The first is, will you veto and or sue if the legislature tomorrow sends you a bill that allows them to call themselves into session? That's the first.
That's a pretty straightforward question. I've made no secret about my understanding of Indiana's Constitution. I remain of the belief that this is unconstitutional. We have supplied our legislative friends upstairs with that background. There is an honest difference of opinion. They believe otherwise. And so I believe that, to your question's point, I'm left with no other alternative. I certainly can't. I believe I'm duty bound by the Constitution first and foremost. And so I can't do an end run around the people. There is, make no mistake, I have not said that I'm in complete disagreement with some of their motives, and I believe they're honorable motives. And I believe that with, for example, the funding that's coming into the state of Indiana, it is beyond understandable. It should be expected that we work together and they be updated. Now, we've been doing that over the last year. Hundreds of letters and phone calls from legislators included, sitting down at a table, going over, as you recall, Nikki, I think, I've, on more than one occasion when we weren't in session, offered, asked leadership if they wanted to be in a special session, and the answer back to me was no. And so I think it's almost a moot question, because we probably could have addressed some of this, but you see it's taken months to arrive at where we are right now. And we didn't have months to make decisions. And so, of course, I want to work with them, but I cannot skirt my duty and do something that I believe is unconstitutional. So to be as clear as your question is with my answer, yes, I could answer that in 4 letters, and it's VETO. Did you have a second part to that question?
I had one follow-up.
Okay.
There's some parents in Northeast Indiana very upset that kids continue to have to wear masks in the schools. And so I wanted to see why you decided to keep that part of the mask mandate, especially since the data that you love shows that the youth are the least impacted by infection, death, hospitalization.
Yeah, fair, understandable question as well. I did read a clip, it might have been yours, on this case. One parent said, and I'll quote or paraphrase, "This is not a killer virus." I could not disagree more. This is a mass killer. There are over 6,000 folks that have lost their life to this virus just in our long-term care centers, and twice that when you total them up. And so there are precautions that we need to take. And obviously with the 8-9 weeks left in the school year, this year, it's working. And we want to continue that. I don't know if you have anything to add about
I think that,
the population of-
children
yeah.
cannot get vaccinated
Yeah,
yet,
I know,
right? We
yeah.
just opened up to 16 and 17-year-olds. And I think it's really important that families feel comfortable that their children could go to school right now and not have an increased risk, because we know the masks have been working in school. So once we are able to have more people vaccinated, I think that makes a lot more sense to not have to have the masks.
Rob Burgess with the Wabash Plain Dealer.
Good afternoon, Rob.
Good afternoon, Governor. Good to be with you at least one more time here.
Oh, we'll get the band back together, I'm sure.
It's been emotional.
I've seen this movie before.
Right. I had a question for the doctors here. What evidence do we have regarding the safety of the vaccine for mothers who are breastfeeding?
Mm-hmm.
And have you seen the resulting antibodies pass between mother and child with breastfeeding, as it seems to do for pregnancy?
Yeah, That's a great question, and there was just a study that came out about that. The CDC is particularly looking at any pregnant mom who takes this vaccine, following them through their pregnancy, getting all their pregnancy results, and then the follow-up with the baby thereafter. And the safety looks really great. What I will say is that the study showed that not only did mom make antibodies that crossed across the placenta to the baby while she was still pregnant with the baby, so they could test the baby's cord blood when it was born and know those antibodies were there, but they could also show those antibodies in the breast milk, which is what we find with influenza and other vaccines, because little babies aren't going to be able to be vaccinated right away. So it's really very promising results and very encouraging.
Jesse with ABC7.
Good afternoon, Jesse.
Hey, good afternoon, Governor. Appreciate it. And to the doctors as well, thank you. So 2 questions for you. One, wondering if there's an appeal to people's better angels, if you will, who are hearing you talk about no residency requirement. I'm thinking there are a whole bunch of people who live just over the border in Chicago. And, just a reminder, we're still in 1C of the eligibility for people who are essential workers. So we're not even at an expanded age eligibility, even close to 16 and above. What do you say to people who are hearing this and thinking, I'm just going to go over the border and try to get this? And at the same point, how would you reassure your Northwest Indiana residents who are worried that doses set aside for them are now going to be taken by people who shouldn't be getting it because they don't live here or work here or spend a lot of time here? And then secondly, just going back to masks, I know, Governor, you're talking about there are a lot of numbers you look at, and we're seeing cases ticking back up, hospitalizations, and we know that hospitalizations and deaths lag behind cases. So I'm just curious what that break-even point might look like, because even though more people are going to be getting vaccinated and protected, it's going to take weeks, if not months, for those 5.4 million people to get their shot. So just curious, what that push-pull looks like, where we're getting more vaccination, but not necessarily catching up with the spread.
You want to take the first one first?
So what I would say to people in Northwest Indiana is that we already have a large number of sites there. We are expanding this with the FEMA mass vaccination site and our mobile units going out. So we have the ability to do 3,000 doses a day over the next 8 weeks, and that residents of Chicago have a FEMA site right there in the convention center that they can go to.
Yeah, and Jesse, I would say, not to repeat myself, but and I understand your question. As we can, we don't look at just one number. We don't just look at that positivity rate. You're right. We look at the hospitalization rate. We look at the death rate, how it affects downstream, the activity, the rate activity. But I'm focused on our ability to care for those who need. And that we have the resources to care for those who are in need. And in terms of our PPE, in terms of our therapeutics, in terms of our ICU bed availability, in terms of doc availability, assistant availability, all the stressors on the system, understanding also, as you point out, that there will be, as more people get vaccinated, what I'm pleased about, we got a long way to go, but when you look at this chart, I mean, there's some good news in this chart, but we have a long way to go. But also what we're starting to see is that hesitancy also start to tick down in certain groups. When we were at the very outset of the vaccination process, we were talking about a much different percentage than what we're looking at here today. And so I do believe that the more people that get vaccinated, it will have a positive impact on our death rate. But also the number of people that have had COVID as well factors into that equation. So when we start to, and I do look at the slope, whether it's inclining or declining, and I look at the plateau where we've plateaued at. But I want to make sure that we have the ability to continue county by county, region by region, care for those who are in need. And we know the vaccine has a positive impact on that, and our personal vigilance, each and every one of us.
Caitlin with the Indianapolis Star.
Good afternoon, Caitlin.
Good afternoon. You had made it clear in your speech last week that local units could still implement their own COVID restrictions Lawmakers had amended a bill today making it more challenging for local communities to implement more stringent COVID-19 restrictions than the state. Does this legislation concern you, granted that it seems to make it more challenging for local communities to do that?
Yes, it concerns me. A lot of things concern me. And I haven't had, Caitlin, to be fair, I think this happened today. I haven't had an opportunity to look at the exact language of the amendment. Didn't see it before the hearing. So we'll take a hard look at this. As Nikki earlier asked about one bill, fairly obvious on where I am on that. Can't spell it out any clearer. But on this, I'm going to have to, Caitlin, I'm going to have to look at each and every word and how it's changed over the past 3 months to where we are today. So to be determined. But yes, it does concern me. And all these bills and there's multiple, that have anything to do with how we manage our way through this thorny period in our state's history concerns me. It better concern me.
Justin with the Westville Indicator.
Justin, afternoon.
Good afternoon, Governor. Since this is the last regular briefing, I and I'm sure many other journalists would like to thank you for holding these press briefings every week for the past year. For smaller papers like the one I run in Northwestern Indiana, it's been great to be able to ask state officials questions directly. So I'm wondering if you would give us some insight into what it's been like to be the state's chief executive during one of probably the most challenging times in state history. How has it weighed on you and Dr. Box for that matter over the past year? Would you pull back the curtain and tell us what it's been like?
Well, I hope that that's true. I'll buy you some time here to think about it. I mean, number one, this is not going to be our last. This is no final curtain call, to use your analogy. It does feel a little bit like going to Oz and you pull the curtain back and you see how decisions are made or how we arrive at them. But I hope, if anything, I always look for the good that comes out of the challenge and the opportunity that's presented itself. And so we'll be looking at, Rachel and I have talked about this, we'll be looking at ways to still be connected with, as you say, all those small schools out there that didn't have a chance to make it to the big game, but all those small publications, news outlets that have invested a lot in making those connections as well. It's not just us. It takes two to tango. So we've appreciated, in a public health crisis as it's been, to be able to get the word out across the state. And it wasn't just us, it was you too. So thank you. How it's weighed on me, I've always tended to be an optimistic person. And I will tell you, I've flat out, this is not rhetorical, been inspired by the strength and resilience and Indiana's soul as a state. It's been phenomenal to watch so many people come to so many others' aid. And I don't let the folks who try to tear that down or remain in denial get in the way of all the good and all that we've endured, and what we should remember, both in terms of loss and gain throughout this past year. I said maybe at the first or second of these, Rachel and I disagree about how many of these we've had. Rachel says 97, I say 93, only because she says, well, I say there has to be an opportunity for questions, that we have to be available to do just this. But I said that our goal would be understanding what a challenge, not fully, but understanding what a challenge laid ahead, that we would seek to become ultimately stronger after than before, even considering all the loss. And in many respects, and I'll take an opportunity to say this, in many respects, about all the good work that's occurring upstairs right now in this final 3 or 4 weeks. So I don't let the challenge anchor me into a place of despair. We have way too many good Hoosiers around the state of Indiana with their expertise that they're bringing to bear that are helping us weather this storm. And with that, I'll pitch it to you.
It's hard to really put into words what the past year has been about. I will say that it has been, for me, the most challenging time of my life in my professional career. Certainly not something that I expected when I took this job, but not something that the state of Indiana expected. The personal toll and the stories that Dr. Weaver and myself and Dr. Sullivan and the governor have heard have been at once heartbreaking in some situations, uplifting in other situations, incredibly affirming of the Hoosier spirit. And a lot of people feel that the burden might have been tremendously just on me. But what I will say is that this has been an incredible team effort. This has been many physicians from the state of Indiana gathering together, many physicians from our hospital systems and from our local health departments gathering with us. The partnerships and the collaboration has been absolutely incredible. And so when I look at it, it has been two of the hardest things for me have been the incredible loss of life and the toll that we saw on our long-term care facilities. And then in the last 8 to 10 weeks, not having enough vaccine to give everybody when they want to get vaccinated. So now is a time of incredible hope and light that really I see that ability for the Hoosiers to get back to the lives that we're missing, that we love, our loved ones.
Yeah.
And just incredibly blessed to be sitting next to this gentleman on my right for all these weeks, because the real true burden fell on his shoulders for a lot of the major decisions that had to be made, taking input from all over the state and from all of his consultants.
Spring is upon us, Justin. It's a time of blooming and renewal. Easter right around the corner.
Selena with WSBT.
Selena, good afternoon.
Good afternoon, Governor Holcomb. I wanted to ask you about, I know these briefings are coming to an end soon, but it's probably sooner rather than later. We're going to be having more supply than demand for the vaccine. And Indiana is one of the states where people aren't wanting to get vaccinated as much as other states. So what are you guys going to be doing to continue to push getting people, signed up after the demand goes down? And are you guys worried about possibly, not reaching that 70% for herd immunity if enough people refuse to get vaccinated?
Yeah. Dr. Weaver, you want to answer Selena's question, then we can follow up as well?
Yes, so that is really when I think the hard work starts, when it's that time for communication, that time for outreach. And that is partly why we have started with, several months ago thinking about this and talking to the businesses and industries. How can we get vaccine to people, especially in groups of people that they feel comfortable with. So working with our community partners, our mobile clinics to bring it to churches, to community centers, to high schools, maybe even to younger age groups if we can get that Pfizer approved for the 12 to 15-year-olds. And we need everybody to help pitch in and talk about their experience and the symptoms they did or did not have and what it was like to get the vaccine and the incredible relief that you feel after you've been vaccinated, that you're protecting yourself and protecting others.
Darby from WDRB.
Afternoon, Darby.
Hello, can you hear me?
Crystal clear.
Okay, perfect. Well, good afternoon. Governor Holcomb, this question you have touched on some, but I just wanted to see if there's anything else you could add. We did watch that press conference from Governor Beshear the other day, saying that he would like to see you reconsider that mask mandate becoming an advisory. And I wondered if there would be anything that would make you want to reconsider that if cases, unfortunately, hopefully they don't, but spike after spring break or something like that. And then also, Dr. Box, how concerned are you about these variants that are coming into the state? And are you thinking that that is a reason why cases have spiked back up a little bit?
I'll take that first and then I'll answer.
So I would say, yes, I'm concerned about the variants. I mean, you can look at other states, you can look at other countries, and you can see when this B117 variant became a predominant virus that was infecting, or the dominant strain that was infecting individuals, that it is much, much more transmissible and appears to actually put more individuals in the hospital. So absolutely, I'm concerned about it, and keeping our number of infections down is the most important thing we can do to prevent the spread of those variants.
Yeah, and Darby, I really don't have more to add. I don't plan on conducting state negotiations through the media, but Governor Beshear has my direct phone number, and he's happy to call. I'm not looking to change my mind, but I'm happy to hear his reasoning behind his statements that he made to you.
Thank you for joining us. That concludes today's briefing.